Ohio by SV and IPV prevention efforts. And then we're going to assess those for cultural competence and accuracy of measurement. And if you know anything about measuring these things, it's, you know, like we think we're measuring what we're measuring, but we're not sure, so we need to make sure that that's happening. We want to provide technical assistance and training related to capacity building for evaluation in Ohio, and that kind of links back into empowerment evaluation. To operationally define incidents and prevalence of sexual and intimate partner violence, just because there's so many different ways you can talk about it. And for prevention efforts, to have a standard definition might be helpful. And that's kind of pie in the sky, but we're going to try. And state level mechanisms for collection of this data for use by local communities as well as statewide efforts.
And the last one is we call empowered local communities. And this is, again, where there's a lot of overlap with just even being here today, that in talking about primary prevention, we're obviously really needing to focus on youth, you know, that we want to get violence before it starts and impact people early on in their lives. So we really have identified that needing to find ways to align what we're doing with the efforts of other youth-serving organizations is going to be critical. So what we're hoping to start doing, really, we actually really already have started in some of our local programs around the state. Like for example, in Cleveland, the most clubs that I mentioned are working with the Boys and Girls Clubs, and they're finding some real overlaps between what the goals of the Boys and Girls Clubs are with the youth they're working with and what we're trying to accomplish with the violence prevention. So that's an example of something that we may explore building in other ways, or finding other ways that what we're trying to do overlap with the efforts of others that are also working with youth. And we're hoping as a part of that to create some online tools that can be used by local communities or local organizations, and then having some kind of a statewide, you know, big splash kickoff to let people know that that exists and what we're trying to do, and again, trying to bring as many people as possible on board with this work. Move forward.
Well, and so what we have now is a focused conversation crafted that we could engage you in, and I'm not sure if we should just take, like, so are there any questions right now? Anything about anything that's happened? Yes.
I always have questions. I was a direct service provider, so we provided intervention services. How does the prevention community feel about intervention services? I know that there are...
They should exist. No, just kidding.
Oh, they have to exist.
Yes,
but secondary and tertiary, yeah, we did that type of prevention, but obviously it wasn't focused on the primary prevention because we had people who, the time that just happened, they need immediate services.
Yeah.
So, do the intervention and prevention communities get along? Is there like a mutual respect for the others?
I think it's growing. You know,
I mean, as a funder, and we do fund local programs, and we require that people doing prevention have relationships with people that do intervention services, because you can't talk about these issues without producing crisis. And so they need to know what are the resources in their communities to refer people to, who realize through the process of learning about this that maybe something that happened to them has a name and has something that they can do about it. So from a prevention perspective, it's critically important that we have that knowledge and those relationships. And I think the other side of it is we really want people that are doing intervention services to learn about and understand what we're trying to accomplish, because it's everywhere. You know, prevention needs to occur everywhere, and so doing it, you know, integrated into intervention services is also really important.
Yeah. And where I said they shouldn't exist, that was just like a smart, you know, that was my smart mouth. Yeah. And really, you know, we talk about that you cannot, it's, we at OPBN no longer believe it's ethical to begin primary prevention services in a community where there's not an already existing infrastructure for intervention services because of exactly what Debra said. Because when you go out and you start doing teenage violence prevention in the school, kids start coming up and disclosing. And if you don't have services to refer them to, you've just done a disservice. You know, so we really encourage that continuum of services from tertiary through primary prevention. That those are really all very important services to have. And the healthier communities are probably going to have a better ability to meet the needs on that whole continuum of services.
Debra, you mentioned the local programs funds. I guess I've got a couple of questions. Can you describe some of those? And what's happening in the budget?
Actually, my phone number is not each right
So our funding is federal, so right now we're safe, although you never know what might change. It's through the Violence Against Women Act, which is a federally implemented legislation that goes in 5-year blocks. So we're funded for 2 more years right now. And the programs, I mean, they're spread out geographically around the state. Almost all of them are doing something in the schools. Some of them are also doing community-based work. Some of them we have 3 or 4 that are doing really exciting peer-led programming where they'll train a group of students to work with other students. Others are doing things like the most clubs or variations of the clubs. But then also there's girls groups, girls clubs that do work with girls only. So it's a pretty big range. And I mean, it's kind of exciting to have the range because people are really trying out new things and being, I think, very creative and innovative in what they're doing. But we also are excited about what I was talking about in the plan, beginning to have a little bit better evaluation and some recommendations so that hopefully we can begin. It's not that we want everyone to be doing the same thing, but we want to kind of be sure that everyone's having a more equal level of success with whatever it is that they're trying to do.
And we want to build a body of evidence that anything works, right? Because there's not a whole lot of evidence that anything works. On the Delta side, we fund only 3 local communities, and very similar to Debra, one's in Toledo, Lucas County, one's in Knox County, and one's in Warren County. And they're doing similar kinds of things, working at different levels, but all seem to be engaged at some level, working in schools with youth. It's sort of like that's where we all go to. We're trying to get people to think beyond that, like what can adults do to prevent intimate partner violence, but it's not so intuitive necessarily.
I think it's hard to get business.
Oh, it sure is.
Was absolutely ideal.
Right. That actually brings me to something I wanted to say earlier and I forgot, which is, I was talking about overlaps and related work, and one of the things that we've just begun to do a little bit better, I think, with is working with anti-bullying efforts. That's been maybe more in the news, and there's been some legislation passed that requires bullying work, and bullying almost always has some sexual violence component to it, or will if it hasn't started there. Right. So we are really trying to get more conversation going about noticing and doing something about that. Yeah.
I think she was saying something.
Okay, sorry.
Over here and then over here?
Yes.
Okay.
I was wondering, I'm in school in North Carolina right now, and I do some research with intimate partner violence with LGBT same-sex relationships. And I wonder, I know in North Carolina there's, even the legal system, there's these really rudimentary laws that don't protect LGBT individuals who are in these intimate partner violence relationships. And when they go, and so I was wondering how that is in Ohio, and what, on the legal system side, how that integrates into this public health issue.
Really good question.
And I might want to jump in at some point on that.
Okay.
I mean, the first, I guess, hopefully good thing is that laws are gender neutral in Ohio, so that legally isn't a hurdle. It doesn't mean that
it doesn't still have,
absolutely, that there could be issues that you
right. No, I wasn't. I wasn't able to do that, but I think in terms of the fact that in Ohio we have proposed legislation for protection orders for teens, but it's been derailed because they now create, the amendments to this law